I'm ready. I don't know if Westborough TV is.
Okay, it's 5:30. I'm going to call the meeting to order. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, the order also imposing strict limitations on the number of people that may gather in one place, this meeting of the Westborough Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found on the Town of Westborough's website at town.westborough.ma.us. For this meeting, members of the public wishing to watch the meeting may do so in the following manner: westboroughTV.org. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the town's website an audio or video recording, transcript, or other comprehensive recording of proceedings as soon as possible after the meeting. Okay.
Hopefully that's the last time you have to read that.
I hope so too. Okay, so with that in mind, I wish to start the meeting by welcoming our new board member, Dr. Melissa Marr. Do you go? It shows up as Robbins, but do you prefer Marr, or what do you prefer?
It's Robbins Mayer.
Mayer, I'm sorry.
It's okay. It's my middle name. Robbins was my maiden name.
So Robbins Mayer is how.
Yeah. Where did it show up as Robbins? Now I'm curious.
So when you look at the screenshot on the camera, probably where it says "you" to you, it says
Okay.
Melissa Robbins to us.
Thank you. I will change that.
I'm not sure you can. I don't know how it shows up, but in any event, okay. Well, welcome.
Thank you.
I don't know if you recognize the background, but I'm currently sitting in a office in Southborough Medical Group where I'm filling in for a couple of shifts now and again.
That might be my old office, actually.
Could be. In any event.
Well, welcome aboard.
So welcome aboard. A couple things just as by way of orientation. So we have 3 members of the Board of Health. Quorum is 2 people. So as a rule, we do not exchange any information amongst ourselves outside of the board meetings because of open meeting laws. Things that we can communicate through email are what I would call administrative things, like, when do you want to meet? We have to have a special meeting for this or for that. We can obviously exchange information around that, but nothing that would smack of deliberation or exchanging information that might be part of that. It should be conducted. All communication essentially would go through Ray as the interim director or the director, or through Paula. So if you want materials distributed, it can be handled that way, that type of thing. So that's some general background. One thing I think both Nathan and I have done early on in our tenures on the board that I think is very helpful. If you can find some time to visit certain things that we are responsible for overseeing, such as the transfer station, and also, if you can stomach it, the sewage plant. It's interesting. It gives you a perspective of some of the things that are happening behind the scenes that are our responsibility.
The restaurants in town.
What's that?
I chose to go to the restaurants.
You went to the restaurants. Yeah. Also, I following along for a restaurant inspection, which I also have done, is also very enlightening. So it's just there's no rush on that, but those are things you might, if you can find the time to do, it'll help. I think your experience on the board. So welcome. I don't know if you have any questions so far.
Not yet. Thank you.
Great. Okay. So then let's move on to approve the minutes from April 20th.
So I'd like to make a motion that we.
I'm sorry. Actually, it's from March. But go ahead.
Yeah, I'd like to make a motion that we accept the meeting minutes from for the March meeting.
I actually had I will second that, but I had a correction.
Okay.
So Paula, if you've got your editing pen ready, on page 4. You're on mute, Paula. Paula, are you there?
Yeah,
So-
I got it. I think it's the April minutes, isn't it? I think I actually,
Oh, you're right. You're right. It is April. I'm sorry.
Yeah.
I'm forgetting what month this is. My bad.
I adjust my motion with the caveat that whatever correction, Alan, what were you looking for? as far as-
Okay, so under where we were discussing the candidates for the Board of Health position,
yep,
and comments included the fifth bullet where it says there's only a material difference. It should say this was the only material difference.
oh, right, okay.
Okay, and other than that, so I will second the meeting minutes approval. And so everything, because it's a virtual meeting, is done by roll call vote. So Dr. Walsh,
Dr. Walsh, yes.
Dr. Robbins-Mayer,
Yes.
and Dr. Ehrlich, yes. Okay, so the minutes are approved. Okay, we now have the interim director sanitarians report for March 2021. I think that's why I got confused. Okay, and then there's also April 2021.
Yeah, I think the March one was left out of my packet, and so I didn't vote on it last month.
Right.
Yep.
At this point, I didn't have any.
I have one
either of them.
question there.
Okay.
On the first page, we say our vaccine orders have been refused twice so far due to an inefficient supply. I think it should say insufficient. It probably was inefficient too, but grammatically insufficient makes more sense.
That's fine.
Nothing else on that one. We can do
let's-
them both together. So go
Okay.
on to April, Nathan, if you have a question or comment.
Yeah, with the April sanitarians report, a question about the pool openings. I know that you said that you weren't sure whether you were going to be able to get to them with all the duties. Hopefully the duties have gotten to the point where we can do those. I think that pool openings should be kind of a priority in some of the stuff we're doing right now.
Yeah, I started pool inspections last week. I did 2 last week. I did 1 yesterday, 1 today. I have 3 tomorrow and 2 on Thursday.
Okay, so it sounds like you're putting a priority on them, so that's good. Excellent.
Yeah. Other things are slowing down a little bit, not much, but enough where I can get some of this other work done.
I had a question for you, which again, it's I think all the more timely because we have a representative from the Waste Management Committee. Transfer station, you got 3 complaints about odors and flies coming from the composting bin.
Yes.
What's the story with that? Can you elaborate?
So I had 3 different people called. They were questioning that they went over to the bin. They were doing recycling of their organic waste, and as soon as they opened the bin, flies were everywhere. The odor, the stench, everything. And it was a warmer day, so I understood. She asked if there was anything we could do about it. I called Harvey's, and they pull it every day. They're not going to pull it multiple times during the day. That's they don't have enough time and guys to go in and pull it every time someone thinks it smells. So I talked to Jerry, he's the coordinator for safety up there, and he said they pull it at the end of every day, and they put a fresh bin out in the morning. So the smells are just what happens that day. Not much we can really do about it. They don't want to spray anything into it because it's going to go through the
Organic
machine afterwards. So they don't want to put any chemicals on it because it changes the whole reason of why we're doing it, to compost. So that was just what's going on. We did have 3 different complaints. One woman said we need to get it out of there. It smells too bad. Another gentleman said that he wasn't going to compost anymore because the odor was too bad.
So my impression is that all 3 of these people, though, were people that were composting, and that was why they were over.
They were all people who got free buckets when they did it last spring.
Yeah.
When about the bucket. So these are people. One woman said, "Well, where can I leave my bucket? I don't want to do it anymore." And I said, "Well, just take it home, rinse it." I said, "Use it something. Maybe in the winter, there's not going to be as much odor because it's not warm out. So you may want to do it then." I said, "We can try and find a plan, but as of this point, there is no plan for that."
Yep.
All right. I think it's something we just need to monitor and see, because obviously, that if persists throughout. I mean, we started this in the fall, so this is really the first time we're getting a lot of hot weather, and so if it continues to be a problem in the summer, we may have to think of alternatives. Maybe put it over where you do yard waste or something like that. Although that would help the people who are just going there to do other types of recycling or getting rid of trash. But if the people have, if the problem is every time I open the bin, it doesn't matter where the bin is, it's still going to be a problem with the odors. So,
Yeah, I had one more question about
ahead.
nuisance complaints on 95 Fisher Street. Just kind of wondering whether that's been resolved or whether that's still ongoing.
Drove back the other day and they have
Their cover on that?
cover on the dumpster.
Okay.
They still have the dumpster in the yard. They had a top covering part of it and only a little bit was open. So it looks like they're following that. I didn't see any trash on the ground. So it looked like they had I sent a letter. It looks like they're following my directions.
Good. I don't have any other questions.
Melissa, any questions from you? We
Yeah,
have
I
a
make a motion that we accept both the March and April sanitarian and we're calling it now a joint interim director report for March and April.
Melissa, you're free to second it if you like.
I second the motion.
Okay. Any further discussion? Okay, we'll do roll call vote. Dr. Walsh,
Walsh, yes.
Dr. Robbins-Mayer,
Yes.
and Dr. Ehrlich, yes. Okay. Health inspectors report for April.
I had a question about the temperatures at Roach Brothers and Subway. I'm just trying to get myself oriented. Are we talking about Fahrenheit or Celsius when you say that like the hot water is never reached above 60 degrees?
That would be Fahrenheit.
Okay, so that's pretty cold for hot water.
Correct, yes.
And so did we shut them down until that was fixed?
No, so the general manager was walking with me and he was correcting that on site while we were there.
And so it did get up to a more normal hot water
Correct, yeah.
temperature. Okay.
What was the reason for that?
He didn't specify. It could have just been, I was there fairly early in the morning and it could have just been that the water hadn't been turned on yet. They were using a different sink in that specific area. So it, like I said, it could have just been that it wasn't turned on.
Got it. I didn't have any questions. Seemed like a lot of the inspections were for very sort of low risk places that are only selling prepackaged foods and things like that.
And so Maria, just in terms of how things are going, it sounds like over the past few months, you've kind of moved up from just all the easy places to some of the more complicated places, and just kind of wanted to make sure that things are going well, and also then to check in with Ray and make sure that, you still think that you're comfortable handing off all of these to Maria, that she's at the point where she can do it.
Yeah,
so
go ahead, Maria.
Go ahead.
No, you go first.
Yeah, so I started off with the low risk to start, but definitely feel more comfortable going in to the restaurants, and they're actually really glad to see my face out there. So it's nice. They've been very cooperative, and they just have been just really, really awesome all around.
Okay.
Yeah, I shadowed Maria on a couple of the higher risk places. I have no issue. I think she's doing everything well, and it's filled a big void, so it's great.
Good.
Good. So motion to accept.
Yeah, I'll make that motion to accept the health inspector's report for April 2021.
Okay.
I second that.
Okay. We'll take roll call vote. Dr. Walsh,
Walsh, yes.
Dr. Robbins-Mayer,
Mayor, yes.
and Dr. Ehrlich, yes. Okay. All right. So the next thing that was supposed to be coming up is the pool variance for Sonesta Suites. It's not scheduled till 6 o'clock. So perhaps we could talk about some of the director's issues in the meantime and get
Okay.
some of that out of the way.
And just to let you know, the Sinesta Suites, no one's coming in for that. That's me that's going to be presenting that today.
Okay, so
What-
just in
the-
case, what's
Yeah,
that?
the issue with that is it's a name change. It's a new ownership of the hotel. So they've had a variance with us for over, I think, 16 years. And the same management, same team is there. They just change names. So whenever there's a change of ownership, we have to redo the variance like we did with
I
Boston.
see.
So,
Oh, okay. In that case, and again, Paul is not on the line, but there was no one who indicated they wanted to speak about this. So then if we're not going to get any other input, it makes sense to just go ahead and have the discussion of that. Why don't we proceed right to it?
okay. So this Sinesta Suites is the on Connector Road, the old the Marriott Residence Inn. So they have an outdoor pool. It's about 10 feet across by 26 feet long. It's 3.5 to 4 feet deep. And they've had a variance before where they don't have lifeguards. They have attendants who, if somebody wants to use the pool, they have to go to the front desk and the attendants come over, unlock the pool, and the attendant stays inside the fenced-in area while the person uses the pool. All their attendants are trained in CPR, first aid, and AED, and they stay there. And then when the person's done, they clean up the pool area, lock it up, and go back to their own job. They've been doing that for years. So it's just we're looking to just renew the.
Yep. My recollection, I don't know if you were around, Ray. There was an unfortunate accident there a number of years ago with that pool because I think a child with some type of developmental problem got in under the fence. They didn't have a wire that went around the base of the perimeter.
That was Park Village.
Oh, it was Park Village? Okay.
Yes.
For some reason I thought it was them, but okay.
Yeah, there was another accident there, but it wasn't that type of accident. There was something with the pool, the fence. Somebody fell and broke something on the fence or the.
Okay. All right. Well, good then. So I don't have any questions about the variance.
Yep, I don't.
Do we want to explain the variance to?
Yeah, please, Ray, go ahead.
Okay, so in the town of Westborough, we require all pools to have a lifeguard at all times. The state says that we don't have to, but that's one of the things that Westborough has done over the years is require lifeguards. So what ends up happening is if a facility does not have a lifeguard and does not want to employ a lifeguard, they have to come up with a variance on how they're going to keep people safe. Some places use cameras, some people use attendants. And this hotel uses attendants, and they put people out there so someone is always with them when there's somebody in the pool area. So if somebody wants to not have lifeguards, they have to come in front of the board and they have to pursue a variance, which this place has had for 15 or 16 years. And whenever a name change or the ownership changes, they have to renew with a new name, new insurance. Does that make sense? Okay.
Any questions?
So I guess I would like to make a motion that we extend a variance to the Sinesta with the same exact wording that we had for the prior ownership, except for with the change of name of owner.
I second that.
Okay. Any further discussion? Okay. Roll call vote. Dr. Walsh,
Walsh, yes.
Dr. Mayer,
Mayor, yes.
and Dr. Ehrlich, yes.
And so, Dr. Ehrlich, I did put together a few slides to try to summarize some of the new guidance from the CDC in the state of Massachusetts and kind of where we are with Westborough. So if that's of interest, I could show some of those at some point tonight.
I think that would be appropriate when we get to the discussion about local guidelines and state guidelines.
Yep. I just kind of wanted to make you aware that I do have something.
Okay, great. I know, so we're getting a little closer to getting caught up on time. And I see we now have 2 people from the Waste Management Task Force, but maybe let's just do the director's reports then. And then we'll come to them at 6:05.
Okay. Some of the issues or, things that are going on, private wells. Right now, the DPW is proposing a new bylaw that would state, you know, when you drive through the Rotary, there's a sign saying, you know, water usage must be cut down and all that. That only applies to people who have town water. Now, because of some of the issues and the droughts, they are looking to have that come forward to people who also have private wells. So they're not using, because a lot of the private wells come from the same aquifer that the town wells come from. And so they want to make sure that everybody is trying to conserve the water. So they just want us to know that if one of us wants to drill a new well, we should let them know that the DPW is looking at these new regulations, and they could be in fall.
You're breaking up a little bit, Ray.
Okay. Oh, sorry. Can you hear me now?
Just the part about if someone wants a well to drill a well,
Yeah.
go ahead and repeat
So if
that.
somebody wants to drill a new well, they just want us to make them aware that there is the possibility of this new bylaw coming into town stating that, you know, they may have to curb water usage for lawns. Because right now, if you want to if you water your lawn, you have to put in a private well. And so you can use that. The problem is now they're going to tell people that no, even if you have a private well, you have to conserve water with us and follow the new guidelines. That hasn't passed yet. This is just something they're looking at, but they want us to be aware.
Would this also apply, like if people have rainwater catch basins and they want to water their lawn from a catch basin? I mean,
no, this is for well,
the same aquifers and stuff like that.
This is the wells coming out. This is going to be well, because when you're doing rainwater, you're catching it and using it again. But the aquifer is where the private wells are going into. That's what they're looking at. The water department's the one running it. They just wanted to make us aware. So I don't have all the information, but that's what they gave me so far.
And they're thinking that this would be a bylaw that the town meeting would pass, or?
I believe so. They're looking for the fall for that.
Okay.
Okay. So this one's a good one. We had a probable case of West Nile virus in
What virus?
West Nile.
West Nile. Okay.
So it was at a doctor's office. It was set up that it was West Nile virus. The state lab got the thing and found out, they retested the sample. It's actually negative. So it was just really weird that we got West Nile virus in May when it usually comes out in September. So we got a big alert, and then they wanted to, before I had already put it on the list to speak about, and then I got a call this morning saying that it was no longer there, that it was found to be negative. But I just want to let you know that there are some I guess some false positive tests for West Nile virus, because 2 different doctors' offices tested West Nile virus. The state lab and another private lab tested no. So we have to go by the state lab.
Okay.
So one thing is the shared services grant. We did receive that with 3 other towns, and that will be starting up July 1st. It started now, but we haven't gotten the funding yet, so we're holding off till July 1st. We will be getting I think a 0.5 full-time equivalent public health nurse. We'll probably get somebody about 20 hours a week in town to do some public health stuff that we haven't been able to do ourselves, some nursing things. The clinics are starting to wind down. Our plan is to do the last first dose of Moderna on May 28th and Pfizer on June 4th, and all clinics will be done by June 30th.
And so does that include getting to the homebound people? I think that's what we were.
That's done.
That's all done. Excellent.
That's done. We're all done with that. Just because the chief went out and 16 of the people he went for homebound, he went 3 times and there was nobody home. So if you're homebound and you're not home, then you're not homebound. So, and he found out later that people were out driving around and going to stores. So if you can go to the store, you can go to the clinic. So he wasn't going to continue going every week trying to catch these people if they weren't there. So there is later on there's on 6/20 we have a vote to appoint, so that I don't have to get into that right now. We have a large scale event coming at the DoubleTree in October. This is something we can talk about at the next meeting, but I wanted to make you aware. They're bringing in, it's going to be music and cars and food. They're bringing in a tattoo shop with 2 artists. We do not have a temporary tattoo permit. We have a yearly permit and yearly license for the artists. I'm looking to figure out what we can do to have them come in for 3 days and figure out what we can charge them for that. But that's something I'll put on the agenda for next time to discuss. So,
What time frame were they looking for that event?
excuse me?
What time frame were they looking for that event?
That's a 3-day event, a day event in October.
October. Okay.
Yeah, a long weekend. I think it's a Friday, Saturday, Sunday in October. Running it up in Boxborough for the last 5 years, but they outgrew the hotel. So they're coming to the DoubleTree because they have a lot more. They're looking over the 3-day period, they'll get about 2,500 people come in. Food, music, and all that. Let's see. Just want to make sure. Yeah, I got a couple more minutes. So 2 of those go to. Oh, yeah. So the Harvey contract, we haven't had it signed yet. That won't start until 7/1, but we'll discuss that in the next waste management team. So as everybody's heard, and the schools have called me multiple times because they actually started new COVID restrictions or lessened restrictions today. Children do not have to wear masks outside of the classroom. So outside in the building, no masks need to be worn. They don't have to, they can share equipment now. We had just voted on allowing them to share equipment up to 24 kids playing like a game of kickball. Saying that we don't need to, they don't have to do anything about sharing. Sharing is allowed. So that would be one that we can look at when you get to that part. Staffing. Currently, Paul and I have close to 150 hours each of vacation time, which we're trying to get used up. It's very difficult trying to get time because with the phone ringing all the time, we have to keep 2 people in the office at all times. We're trying to send 1 person, maybe 2 out during the day, then come back and help out with phones. And due to that, I actually hired a contract inspector using my budget for training. I think I had enough training this year and we could hold off on Maria till July. So we hired a contract inspector to help out with the Title V. I actually have a gentleman who will, if his overtime is approved, is going to be doing the waste management survey and stuff that I can't get to. His name is Steve Bakari. So if he can do some overtime for me, he's going to come in and do the paperwork that I just can't get to. Like he told me, I was on the phone with him today. He told me it'll take me 6 or 7 hours to try and find all the information, call everybody. He already has all the contacts. He can do it in, he said he can probably do it in 2 or 3 hours, get it all done. So he's going to look at it this weekend and he's going to try and get it done this weekend and get back to me. So we should, if things work out by next Tuesday, I should have everything that the waste management group has been asking for the, what is it called? The survey and the shared, and the SMRP grant, I believe it's called. That should all be done by next week if Steve can get to it this weekend. Other than that, I do not have anything.
All right. Well, good. Any questions for Ray?
I believe that we had suspended the senior tax relief program, and I didn't know if something like that, if it were to restart back up, would that help in terms of having somebody else in the office to kind of meet the 2-person requirement or not?
That what really wasn't suspended. That was put on hold. They came back. We had people working. Well, no, it wasn't. No, it was put on hold for 2 weeks, and we've had somebody here since February.
Oh, okay.
Yeah. So, and we've had our second person came in about 2 weeks ago. So that started on May 1st for this year, but we still had somebody finishing hours right through February. She came in. It was only put on hold for 2 weeks until when they had the town hall closed. When the town hall opened back up, we brought everybody back.
Okay.
Had to come back.
But to Nathan's point, those people don't count for having 2 people in the office. Is that correct?
Yeah, they don't count.
Okay.
They're not in the office. They're down the hall. We have them set up down the hallway, so they're not in the office.
Okay.
Well, I mean, it could be that if you set them up in the office, would it count? I mean, we're looking at how do we, make it so that you guys can get a little bit of a break without, working 150 hours without, a break, So
Yeah,
we got to be
I'd
a
have
little bit creative here, right?
Yeah, I'd have to check with Alma and see if we get someone who can answer phones. That's the problem. And, putting people on hold and everything, and then still got to get to all those calls because they can't answer the questions that the three of us here can answer. So that's what it comes down to, is having somebody who can answer the phone and actually understand what they're answering and not information that they're not supposed to give out either. So that's what it comes down to. One thing I did send out is, did everybody get the vaccination data I sent out? The little sheet. So I just sent that by email. That just kind of gives you the totals of where we're at with vaccines and percentage of the population. So right now, totally vaccinated, we have 51% of the town is totally vaccinated. And we have another 24% that is partially vaccinated. So together, we're right around 75% people who are vaccinated or partially vaccinated. If that makes sense.
This is of the eligible population, correct?
Yes. Well, no, this is an entire population. So even though it's 0 to 19, we just opened up 12 to 15 yesterday. So we're starting to get people on that too. So yeah, this is based on the entire population of town, not just the eligible.
I see.
So
Great.
So our numbers are probably by eligible. We're probably closer to 60% fully vaccinated and eligible.
Yep.
Can I ask a question? You mentioned the vaccine clinics are going to shut down as of, I'm sorry, June, what'd you say, June 30th?
Yes.
Is there, sorry, my dog, is there talk about reopening, or is that a definite thing with children, hopefully being approved, younger children being approved soon?
Well, as a group, there's 8 towns that are involved in the vaccination, the regional vaccination clinic. All the health directors got together and we decided that under the age of 12, we don't want it a clinic. We would rather them go to their doctor's offices or something like that. If it comes to a point where we need to run a clinic, we're thinking about doing individuals in the towns at the schools if we're going to do anything. We don't want to bring the kids. They're traumatized enough. They don't need to come to a clinic where there's 200-300 people. We'd rather do it in a school cafeteria or something a little smaller. But as a group, we decided that's the group we'd like to see go to their doctors more than come to us.
The other thing that
Thanks.
is pertinent in this regard is that the reason we have this regional clinic with these other towns was the state refused to give us vaccine just as a single town after we had done first responders. And so that was at a time when there was a shortage and they were trying to distribute the vaccine as equitably as possible. But, it looks like going forward, lack of vaccine is not the limiting factor. And so, I don't see us having to set up a regional clinic again after the end of June. It may be like Ray says, we'll do something at the schools or, it hasn't really been rolled out from the state. Are they going to give doctors' offices, supply? Because they weren't doing that before. So a lot of stuff still has to be clarified.
So the regional clinic luckily we can still order as a clinic going forward right through until this is over. So what would happen is Chris from Northborough would order and then transfer them to me and we would do them here, or we would just use them under the clinic name and then just run the clinic here as a regional clinic in the town of Westborough for the school children. And we would do it to every school. So that's kind of, in every town, we would do one at every town. So it would still be a regional clinic. We would just not open it to the public. We would have regional private clinics and do that as best we could.
All right. Any other questions for Ray? Okay.
Not at this point in time.
All right. Well, let's move on then to the Waste Management Task Force. So we have Lauren and Katie. Who's going to be speaking first?
I will.
All right. So Katie, so just to remind you, when you start, just give Paula your name and address. Same with you, Lauren, when you speak first.
Okay. Katie Curtin Mestre. My address is 26 Linda Street. Lauren, want to give your address?
Sure. Hi, Lauren Burstati. My address is 19 Haskell Street.
And what Lauren and I are going to cover today is a proposal that we'd like to bring forward to get approval from the Board of Health to investigate and do an informal RFP for a town curbside all-in waste recycling and composting program. And now we'll take you through the details. And Lauren and I will be co-presenting. So slides to come up shortly.
As Katie pulls the slides up, I just wanted to thank you for giving us some time on your agenda today. I know you're all very busy. I appreciate it.
All right, I think slides are up. Do you see them, Lauren?
They're coming
Yep.
for me.
Great.
All right. Thanks, Katie. Next slide, please. So just to give you a bit of context about where this proposal is coming from. There we go. I just wanted to make a note of Westborough as compared to other communities in Massachusetts in terms of our the waste that we generate. And here is a map of just several towns surrounding Westborough, and being in the red means that we collect we have the most tonnage in terms of waste. So we generate more waste per household than other towns around us and most of Massachusetts. We take about 4,500 tons to Wheelabrator each year. And we have an average, and this is based on 2019 data, since we don't have 2020 available just yet, to us at least. So on average, there's about 2,200 pounds of per household per year in Westborough compared to 1,200 pounds per household per year in other central Mass communities. So we really need to get these numbers down, which is very much a reason of the Waste Management Task Force and why we were created. So if we continue on this path and not reduce it or make much headway, then we won't be supporting the Mass DEP's goal of reducing trash by 30% in 2030. That being said, we have been making some progress since, especially within the last year or so, is when the task force started meeting. And as it was noted earlier in the meeting, since November, there's the organic waste bin at Harvey's transfer station. I thought that was a really good win for the town. And we only have data for 2 months so far. It's a little bit difficult to get this data from Harvey's, but we have from November of 2020 and January of 2021 for a total of 6.53 tons of organic waste that was diverted from the incinerator, which is great. And I'm sure there's more than that. We just don't, again, have that data. And also 58 families in the town is signed up for Black Earth composting service, which picks up their compost from their driveways. Next slide, please. There was a survey that was circulated early 2020, and it looks like about 919 respondents. And of that, it's a little bit small to see here, but there was a large interest in townwide curbside program and also a large interest in composting in general. Thanks, Katie. So I believe it was around 60+% of residents that completed the survey would like to participate in a townwide curbside program with trash and recycling. Just under that was pickup and compostable items at the transfer station, which again we tackled. And there's some other questions about stickers at the transfer station and so forth. Private composting service, which we do offer as well. So just again, wanted to give you a little bit of background on the waste problem in Westborough and the interest by the residents for an all-in curbside program. And I'll hand it over to Katie at this point to continue.
Yeah, and I think the only other thing I would add to what Lauren said, and thank you so much, Lauren, is we recently agreed to a climate action plan here in Westborough that we're driving towards. And there are many things that will contribute to the climate action plan and the reduction of greenhouse gases. Certainly waste is not at the top of the list, but waste is part of the equation and part of us reducing our greenhouse gas emissions as a town and supporting the climate action plan. With that, just to remind folks of what is the cost of our current program. I won't go through all of these details. You guys are familiar with these details. I think it is important to point out that the curbside program currently costs $49 per month for weekly curbside trash and every other week recycling, with a very generous 96-gallon cart. There's also a $150 fee for cancellation. We've certainly heard some negative feedback on Facebook and other forums on this, but it's not really anything that we can address as a town because it's a private program. But I think it's really important that we remember that the program that we have today, even our curbside program, is partially funded by the town because we're paying $42 per ton for transfer station and curbside waste. This is due to go up to $44 in FY 2022. And then we also pay $69.82 for the wheelabrator tipping fee. And we're currently paying $80 per ton for the food waste at the transfer station. So what we would like to get the approval from the Board of Health to do is to research a new curbside all-in program that includes trash, recycling, and composting. Looking at other towns that have done this successfully, like Hamilton, it would likely look like a weekly trash, recycling, and composting with a smaller cart, a 35-gallon cart, because that's what will encourage residents to recycle and to compost. Curbside fee for bulky items, and curbside leaf pickup 3 times a year. So again, we can divert the organic waste from wheelabrator. Of course, we would continue to have the transfer station option, but continue to look at ways that we can reduce waste brought to the transfer station. In terms of the proposed funding model, we would be proposing most likely a quarterly fee paid to the town, like the water bill. So you could either opt in for the town curbside program, the town transfer station program, or you could have both programs. People already kind of do that today with private curbside program. So what we're hoping today is to get the approval from the Board of Health so that we could move forward with an informal RFP from up to 3 vendors. And that way we can understand what the cost of this new program would look like, and also benchmark the cost of other town curbside programs in parallel. And then ultimately, this is our timeline that we want to follow. Hopefully review RFP responses in June, give an update to the Board of Selectmen in July, do a roadshow to the various appropriate committees and have open public meetings to discuss the proposal. Board of Selectmen update number 2. See if we need to have a warrant at the October town meeting. And then hopefully by end of year, we're selecting the vendor once we issue the formal RFP. And then ultimately we are live with the new program in June of 2022. So that's kind of the overall timeline and the proposal.
So I guess my first question for you would be if you could elaborate on the 35-gallon cart. That sort of stood out to me. You know, if people are currently who have Tidy Town using a 96-gallon cart, that seems like a significant reduction. And is that gallon just trash, or is that trash, recycling, and composting all in 35 gallons?
That's a trash cart. That's a trash cart. We could certainly, when we issue the RFP, we could also look at the next size up. So there's 35-gallon, and then the biggest one is 96-gallon. And there's definitely some, Dr. Ehrlich, some sizes in between. So we can look at what are the options for the cart size. But I think one of the things that's gonna be a big change is because the trash, recycling, and composting is weekly, it will be easier for people to recycle. What we have heard anecdotally speaking is that because the current curbside program is recycling every other week, sometimes people have too much recycling and they really can't hold on to it for every other week, and they just proceed to throw it away.
Yeah, I mean, I'm in agreement that the weekly trash recycling and composting seems like what you would want. I think that by having it every other week would disincentivize some people from taking advantage of those options. I guess I'm still trying to wrap my head around, though, if we're continuing to allow, I mean, would people then opt into one or the other? Would we still allow them to go to Harvey's to drop stuff off? And then what happens to a particularly large family that generates more trash than a 35-gallon cart will hold? I mean, what options do they have at that point?
Well, first off, we don't have to go with a 35-gallon cart.
Whatever we go with, like
if you look at the town of Newton, and I haven't gone there lately, but I work in the town of Newton. Town of Newton has very good numbers. Their numbers are green. Similar, that's kind of best in class for the state. They have definitely not a 96-gallon cart, but definitely not a 35-gallon one. And basically the rule in Newton is you can only fill the trash for the cart, but it is a decent size cart. And then you have recycle and the compost. So I think we can definitely, flex the cart size. If we agree to move forward.
To interrupt, the question is, what if you had more than that? And what I'm hearing is that you're not allowed to. Is that
in Newton, there are families of all sizes. There are small families and there are big families. The policy that they've adopted in Newton is you have the trash every week, and you don't exceed it has to fit in your cart.
So if it doesn't, you basically leave it at your house until the next week, and then you balance it out over time, presumably. Ray, what do you have thoughts on?
I come from a town that has curbside. We do our trash every week in a 65-gallon container, and we do our recycling every 2 weeks in a 96-gallon. I've never had an issue with recycling. 96 gallons holds a lot of recycling. So I understand you want to do it twice a week, but when we're talking about clean air, you're putting more trucks on the road for recycling too. The other thing I have is I almost never fill my trash barrel. Sometimes it's one bag, sometimes it's two, and I have a lot of space in it. But there's been times where I fill it, but we have overflow bags that you can buy with the town seal on them. They're like $2 a piece. And that if it's overflow, you can pay for an overflow bag. I'm not trying to put more money, make you pay more money, but there is ways that if you're going to go over the bin, then you can buy, they sometimes do have overflow bags, just to let you know.
Yeah.
Lauren, go ahead.
Sorry, Kate. Yes, I really like that idea, Ray. I think that's definitely something that we'll flirt with and perhaps make part of the proposal at some point. I also just wanted to make note personally, when I started composting about a year ago, I do hear your point about large families and if they have a surplus of trash. But once you start separating the organic waste from the trash, you'll see your landfill significantly decrease. And I guess also, what happens now? Do people not have more trash weekly now because it's a larger bin? What happens now if someone has too much trash and overflows their bin? What do they do now, right? They hold on to it?
They get a sticker to go to Harvey's, and then they drop it off at Harvey, or a one-day pass or something like that. And they and they drop off, especially like around, I don't know, for me, Christmas time, when you've got all the wrapping paper, it might be really light, but boy, I can fill 4 bags full of.
The main thing that we want to be able to do is, if we start to socialize this proposal with other committees, with the Board of Selectmen, with the community, the number one question people are going to have is, how much is this going to cost? And the only way that we can get that data is to do informal RFP with hopefully 3 vendors so that we can confidently move forward and say to the town, this is what we believe that this program will cost.
So just to be clear, the difference between the new program and the current program, I just want to be as clear as possible, is that in the current program, it's possible that people having curbside can opt out of recycling and composting as being, it's not automatically available to them. You have to pay extra for it. And so some people pay for it and some people don't. The ones who don't pay for it either throw out the recycling or take it to Harvey's with a free recycling sticker. But that's fundamentally what you're requesting approval for, is to go out for an RFP that would look for a program that mandates the availability of recycling and composting with the trash on a weekly basis. Is that correct?
I
But I just want to hear from Katie and Lauren, just so we're clear.
Correct. And then I think the other difference is that this is a town program. It is not a private program. So as a town program, it is set up in such a way to hopefully achieve our goals of reducing waste.
When you say it's a town program, but it will not be town employees running it. It is fundamentally, we're going to contract out with a private company.
Right.
So ultimately it's a private
But
company.
it's a private company that's accountable to us as the town because we
Right.
selected them.
So I think, Alan, the one of the, as Katie was saying, is that the customers, the residents of the town would be paying Westborough, and Westborough is then saying that we're going to make sure that somebody is there to pick up your trash that meets this type of conditions. And then, yes, Westborough is then paying some third-party contractor to then go and do that work for the town.
So before you go, I'll call on you in a second, Lauren. So the one thing that I think we have to be clear on is, let's just say, for instance, it was not Harvey's. Okay, then are the whoever is picking this stuff up will presumably have to take it to a facility, or the recycling to one facility, composting someplace, and will presumably truck the trash to Wheelabrator on behalf of the town. That's the plan, correct?
Yes,
Right.
because Wheelabrator continues to be our trash to energy vendor.
Yes. So, again, somebody who didn't like either of these two options, they don't want curbside with this all in, and they don't want the transfer station sticker. We can't prohibit them from continuing to contract with Tidy Town.
Well,
But
any private provider, whether Harvey's or otherwise, is free to offer private services.
right, I just want to be clear on that. But the difference is we might not have the same relationship where the town is paying for the burning at Wheelabrator of things picked up by the private hauler.
Yeah, I think the difference with the private hauler going forward, if you go private, it's private. So it's privately paid. We're not picking up the Wheelabrator fee. We're not
Yep.
picking up any fees. If you go private, it's private.
Okay. Yep.
And so when we're trying to do the cost comparisons, it would be that we would still have to fully staff and have operational the Harvey's transfer station, because we'd still be allowing residents to use that. And then on top of that, we'd be paying the third-party contracting service, where presumably we'd get reimbursed from the town, but it would, or reimbursed by the residents, but the residents would actually be paying themselves the full cost of what it costs to transfer the stuff plus to dispose of their trash. And through their taxes, they would also be paying to keep the Harvey's transfer station operational.
Well, currently right now, the residents pay for the transfer station, and I believe
Yeah.
we try to set the fees for the stickers to kind of cover the cost of the transfer station. The curbside program is, of course, partially paid by the residents and then partially paid by the tax base, right? Since we pay for $42 per ton for curbside waste, and then we're also picking up the wheelabrator fee for the curbside. So again, until we put this out to RFP, we will not know. But
if looking at these numbers, right? So somebody that does curbside would presumably have to incur the extra cost of that $100 of stuff that's being paid for by the town per ton, right? And
no. I mean, conceivably, we don't know, right? I mean, this is the thing. We don't know until we do the RFP. But I'm really hoping that when we do the RFP, it could turn out that we could offer a curbside program that's hopefully the same cost as our current curbside program, but a better service to the town. But that's what we don't know, which is why we need to do the RFP.
I hear what you're saying, and try to hear me out. And that's that they would still have, the people who are doing curbside would be paying a group to pick up their stuff and transfer it, and that's what they're paying right now. Right. But that group would also be paying for the like getting it to Wheelabrator and having it disposed of there as well. Maybe it's not Wheelabrator, maybe it's somewhere else, but there's going to be some increase that's not currently being paid by the customer in terms of the
that's not necessarily so, because again, in the program where the new, that's the cost of the current program. Go to a slide with the new program, Katie.
Yeah.
So what you'll see here is it says quarterly fees paid to the town. It doesn't say what those fees are. And those fees in theory would be set. And so again, the town could subsidize the cost of going to Wheelabrator or something like that. So, the idea here is that whatever program these people put out for RFP does not increase the cost to the town. Okay, but the town's already paying some money. So it doesn't mean that the town won't pay anything going forward. And it would, to a certain extent, be up to us to sort out what we think is fair.
Yeah. And when we get to the part about, the people that are currently doing, the transfer station, we had in the past always done that, we tried to get to the point where it was kind of almost self-supporting, where the sticker fees were kind of covering a lot of the cost of running the transfer program. Obviously, if 50% of the people stop that program and switch to curbside, the cost of running the transfer station doesn't really change. We've just lost the number of people that are doing it. And so then we'd have to decide as to whether the town would subsidize more or whether we would not. And so, that's just something that we'd have to kind of think about how we're going to handle. Because it's not like if you had half as many people going to Harvey's that it costs half as much to run the transfer station.
And hopefully we can get some data from Hudson. I don't know if Hudson's plans were delayed on account of COVID, but Hudson actually implemented a program where they had both transfer station and town sponsored curbside. So maybe we can hopefully get some data from them or any other town that offers both, to just aim to your question, Dr. Walsh, kind of model what we think is going to be the shift as we now offer both programs.
Yeah, I think that information would be very helpful, along with if they're willing to share sort of what are the approximate costs that they're experiencing on both ends.
So
Ray, you had a question.
Yeah, so just want to make note, the 6982 ton for Wheelabrator trash to energy fee, the tipping fee, is a municipal fee that the 30 towns, actually it was 30, I think it's down to 22 towns now, have negotiated that cost. If we go to a private hauler, that may not still be at 6982. I know private haulers are paying $80 to $85, so that could go up. So you want to make sure that however that works, that they look at those numbers also.
Yeah, I would presume, Ray, and that's a good point. Currently, Harvey's is a private hauler, and when Harvey's hauls the trash, we're paying the $69.82. So I don't see why it would be different if we now have another vendor.
Right.
It is, you have to look at it because he's a private hauler, but we're paying through him to them. We're paying the fee, but if a private hauler, they pay their own tipping fees. So it's a program we have with Harvey's. So you'd have to try and mirror that program if you had another private hauler.
Yeah, I think to the point raised earlier, it's a town program and we're selecting the hauler and the hauler is acting on our behalf. It's a service that they're running for our town.
Right, but let's say
Yeah.
if we entered into negotiation with, let's say, 40 different people to all bring stuff to Wheelabrator, it would get really complicated for Wheelabrator. And I think what Ray is saying is that we kind of have negotiated to have Harvey's bring it to Wheelabrator, and that's where we get that discount from. And that it might or might not apply if we had some other or multiple other third-party haulers, right?
I also don't think we're gonna have multiple third parties. We're gonna have Harvey's because they run the transfer station and whoever is the vendor selected for our town curbside. Again, the private program is private and they'll have to figure out the 100% private program. They'll have to negotiate wherever it is that they're gonna take it.
Okay.
I've got one more question if I can, Alan.
Yeah, go ahead.
And that's that I assume that the distribution of tonnage per household varies from household to household, and that there's going to be some households that have a lot more trash and some households that have a lot less. And as we start to look at kind of two different options, one where we have curbside and one where we have the transfer station, or looking at who's going to adopt what, I would assume that there's going to be a certain group of people that fit well with the curbside program that are going to be excited and move to that. And there's going to be some group of people that it doesn't fit well and they won't move to that. And the question is this going to actually help the town reduce our trash tonnage? Or is it just that the people who easily fit inside whatever barrel we select are going to move to that, and the other people are going to continue to just put really heavy, large volumes of stuff into the transfer station and have it actually not be much of a benefit at all? And just kind of, what are your thoughts on that?
Lauren?
May I? Thanks. Yeah. So in the background, we are trying to even currently work on this issue of the transfer station right now, because that is a big issue of trying to reduce trash there, or properly recycle, or properly charge for oversized items and so forth. So this is an ongoing issue regardless, I think, of who the private hauler is. And I don't think that the tactics we have to try to tackle that is worth going to a town meeting, but we are working on this either way, whether from the signage that's coming very soon now to even proposing some kind of electronic payment system to make it very simple and easy for those oversized items, and et cetera, possible transfer station oversight person. So I think that is a problem regardless of how this moves forward.
Yeah.
Can I say one thing? I think it's wonderful to hear that this is being looked at, looking at other towns and talking to friends in other towns. I always thought Westborough was a little behind in this and not encouraging people to recycle enough with the every other week and the extra cost. And I was a little concerned when you mentioned the huge bin of garbage. I don't know how big is it. Did you say 80 something right now?
96
96
gallons.
Down to 34 or whatever. I think that might be a little drastic, and then the whole idea of charging per garbage bag, which I know a lot of towns do, I think is a great idea too. But it just, whatever we can do I think the weekly recycling alone that's included, I think is a wonderful idea to encourage people. I think that would change a lot, to be honest.
Nathan and Ray in particular, we had talked to Harvey's about potentially mandating recycling with the trash as a bundled fee. And then there was going to be the issue about the recycling happening weekly. There was some pushback from him on that. I think it was cost related. Is that right?
I believe so. Steve would know more about that than I did. He was one handling that, but there was when Steve had talked to him about having one fee and doing everything. They had said they'd be able to do every other week, but putting 2 trucks on the road every day in the town doing the way they divide the town and everything would be costly for him, and the price would go up exponentially to get it done every week.
Okay.
And composting would be a whole other issue. I don't know if that's something he does for pickup. I'm not sure. I don't know enough about it.
All right, fair enough. Just wanted to get that out there. Okay, other comments, or let's try and move to some sort of resolution here.
I don't have any other comments. I think that the question before us, if I understand it correctly, is whether we want to give approval for this group to go ahead and try to get preliminary RFPs, and whether we have enough detail given to them in order for them to draft that RFP correctly. Obviously, if the RFP is drafted poorly and they send it out and then we find out in October that, the bids we got back didn't really meet our needs, then, we're way behind in terms of getting this done.
So the critical issues are, first of all, to at least get bids with at least 2 different size bins.
Yep.
Does everyone agree that we're looking for a weekly system that involves trash, recycling, and composting?
I do. I think Melissa just stepped away for a second.
Yep. Okay. And are there any other key features that we need to address at this time?
I think it just has to be crystal clear how either they are disposing of it or how it's getting paid for in terms of the disposal.
Yeah, I think in the RFP there should be an assumption that the town will pay for the tipping fee at Wheelbrader.
Tipping fee, yep.
Okay, but we want to know what the cost is for everything else,
Yep.
including disposal of recycling. As I think everybody may be aware, this is becoming an issue nationally where some towns have to pay to get rid of their recycling. We've not had to do that here in Westborough, but it's a concern. And so we've got to be sure we know all costs that are going to be applied to this program.
Yeah, definitely. In some cases with recycling, there can be these arrangements where it's like a cost share, and you can then end up with kind of unknown costs that could hit the town. So we definitely need to understand how they're going to handle the recycling component and who really owns the risk for the fluctuation in kind of the cost, the resale cost of recyclable materials. We're also going to add in, and I don't think we need to detail the fees for bulky items. We just want to add that there'll be a curbside fee for bulky items, and that they'll also add in curbside leaf pickup for 3 times a year.
Yeah, I'm fine with the leaf pickup. The curbside fee for bulky items, I mean, I know many towns just have bulky items twice a year or whatever, and there's no fee. Others are, you pay, you notify them that you're going to have a bulky item. Maybe you pay a fee at that time, and then there's a pickup. So is there any discussion about bulky items in particular?
I would say that I think I agree with Alan that if we have the RFP say that they have to allow for curbside pickup of bulky items and not specify how they want to handle it, then it allows them to be a little bit more creative in terms of if they say, oh yeah, this is fine if you want to call up and we'll do it the day of, or if you want to, just have it once or twice a year, as Alan said.
So I guess the RFP should request a program be specified for picking up of bulky items at the curbside.
I think that it's, as we were talking about escalation of costs, I think that it is important in here that we talk about whether this is going to be, the costs that they're promising us, whether they're guaranteed for a certain number of years or there's certain like percentage increases that they're allowed to have. because we don't want this to go through all of this in year one, and then in year two have them double the price and be like, yep, that's what the new cost is. We kind of want like a 5% or a cost of inflation rider on there, saying that it can't be more than X amount increase every year.
Yep.
Anything else? Any other suggestions or comments? Okay, then perhaps a motion just to endorse going out for RFPs would be appropriate.
Yep, I make a motion that we allow this group to go get draft an informal RFP and to start sending them out and collecting vendors.
Paula? Yeah, I'll get Paula's attention.
We might have to word it slightly differently. But.
Yeah, Paula, if on that, did you get the motion?
Yep.
Okay, so where he said this group, if we could call it the Waste Management Task Force, that'll sound more
Didn't
official.
remember their name offhand.
Okay. Of course.
I second the motion.
Any further discussion? Okay, we'll do roll call vote. Dr. Walsh,
Walsh, yes.
Dr. Mayer,
Mayor, yes.
Dr. Ehrlich, yes.
And I
Okay.
assume that by calling it informal and stressing that part, this is not binding in any way on us to select one of these people that propose a bid. We'll look at the bid and we'll get a chance to review it at that point, right?
We'll absolutely
and
want to
the-
compare to current program, but yes.
Yeah, and then just given that the Board of Health is, continues to be short staffed in terms of the review of the informal RFP, make sure that we haven't missed anything or anything like that. Would we have it reviewed with Dr. Ehrlich, since he is a member of the Waste Management Task Force?
I think that's a good start. Again, we expect to hire a new director soon, as in the next several weeks. But I will know all those things. So if you work through me, I can either work with Ray or whomever is appropriate.
Great.
Do you think the next RFP or the draft RFP will be ready for our next Board of Health meeting or not?
Yes, definitely. Definitely.
So maybe after some informal feedback with Alan or the new director, we could at least see what the RFP looks like at our next board meeting.
Yeah, no, I think that'll be great.
And it might not
Okay.
require you guys to be here. It might just be that you present it and Ray or the director could, present it on your behalf.
Perfect.
All right, let's move on. Next item on the agenda is discussion to vote to remove local COVID-19 guidelines to adopt state guidelines. I requested this be put on
Thanks,
the
guys.
agenda.
Thank you.
Bye-bye. I requested this be put on the agenda, and my rationale was as follows. About a year ago, last March, when we had the big meeting with the Board of Selectmen, and then over the next 2 months as we continued to meet with them on a regular basis, we passed many regulations. And some of these were just endorsing what the state had already done. Sometimes we were ahead of the state. Sometimes we added on to what the state was requiring and any variation thereof. And my feeling was, given the current trends in COVID cases, the high vaccination rate in Westborough, the advice coming out of the CDC, and changes by the governor, my overall sense is that the pandemic is winding down, that it's not over, but we're much closer to the end than the beginning. And the path is primarily that of opening up going forward. And so rather than go and try and figure out all the various rules and regulations we've passed in the past and then amend them in some fashion, we might have one motion tonight that basically says, again, Westborough is ahead of the state on vaccination rates. So can we say that going forward, all the rules that we have passed, the effect of all of them is to say, now going forward, we wish to simply follow state guidance. And as the state opens up, we will open up automatically. So that is what I wanted to throw out there for discussion. And Nathan, I know you had some slides, and if your slides pertain to this general idea, I'm happy to entertain it now, or however you wish to do it.
So I had some slides that were more along the lines of what is the current state of the CDC and the Massachusetts guidelines, especially because Massachusetts has been evolving so quickly. And so maybe that is relevant in terms of if we're saying that we want to just adopt what the state is doing. But in terms of, in principle, I don't have any issue with kind of one blanket thing to kind of rescind all of the COVID related stuff. There are things like, adopting COVID-19 as one of the goals of the Board of Health. And so there might be a few issues in there that might need more fine crafting than just a global rescinding of, everything we've done related to COVID-19.
But again, Melissa, just to give an idea, things we passed regulations on the library, issues related to that. We passed, countless,
travel for employees and, things like that.
Yeah. So.
Yeah, sure. I do have a question on that. I read, the Massachusetts changes, and it's very brief. It's very limited. There's not a lot of detail, unless I'm missing something, and certainly correct me if I'm wrong. And it just seems like, even just for that example, the library, some concern in physician communities that I'm seeing is that this is quick and abrupt, and the fact that a huge percentage of children have not been vaccinated. Should we have more guidelines for places like the library and places where there are a lot of children, for mask wearing? Other things that I had questioned were indoor sporting places for children. If you look, I don't see anything about that from the state. And I don't know if that's just going to be a place by place, private, decisions, company by company. So I'm curious as to your thoughts on that.
All right, well, why don't we start with Nathan? You said you had some slides you want to share with us?
Yeah, let me see if I can switch to present mode. Can you guys see that?
Yep.
So basically, Massachusetts today said that more than 75% of Massachusetts residents are vaccinated. So that's 3.2 million that are fully vaccinated and 4 million that have had at least one dose. And in Massachusetts, the number of new cases have dropped by 89% since January 8th. Hospitalizations are down by 88%. And the positive test rate is also down 88% from 8.7%, I think at its high, to 1%, or maybe even less than 1% right now. And then in Westborough, I graphed the data from the weekly reports that we've been generating. And you can see that we're, down fairly low, not quite our lowest, but kind of what we were seeing at the beginning of the summer, last summer. And so assuming that this is not just it gets bad in the, flu season and gets better in the summer, and that it really is related to vaccines, this is, a great sign that, we've been able to handle this really well in Westborough. And so the CDC, the general guidance for vaccinated people versus unvaccinated people, they say fully vaccinated people can basically resume all activities without wearing a mask or physically distancing, except where required by federal, state, local, tribal, and territorial laws. And that if you've been around someone who has COVID-19, you do not need to stay away from others or get tested unless you have symptoms. And there are some exceptions for correctional detention facilities, other congregate settings. But vaccinated people, the CDC still recommends that people wear masks in public settings, at events or gatherings where they'll be around other people. One of the federal rules is that masks are required on planes, buses, trains, and other forms of public transportation. And so that is unaffected. So the CDC still recommends that you follow the law there. As far as schools, the CDC has gone on to say that for unvaccinated people, masks and social distancing do seem like it is sufficient to keep it from spreading in schools. I'm not going to read these paragraphs, but basically they're saying that schools are very safe, and that in the first paragraph and in the second paragraph, when it relates to sports, that the CDC is still concerned about indoor sports where there's close contact. So in Massachusetts, the biggest thing that's happened on May 18th, they've changed some of the policies that exist that will remain in effect until May 29th. And then starting on May 29th, there's going to be another change. And so right now, masks are required outdoors in public when you can't keep a 6-foot distance, and they're also required indoors in public spaces. There are currently limits on indoor private gatherings to 10 people and indoor public gatherings for 100 people, and a limit for outdoor private gatherings of 25 people and outdoor public gatherings for 150 people. That businesses must still keep the occupancy percentage limits that they've been applying, but that starting on May 29th, the state is saying that non-vaccinated individuals are advised to continue wearing masks and to continue social distancing, that businesses and the local board of health are allowed to require masks, and that all other limits and COVID restrictions are basically no longer required with the exceptions that are listed below. And so masks are required on public and private transportation, they're required in healthcare settings, and they're required in the congregate care settings. So congregate care settings do not mean senior centers, but are more applicable to like homeless shelters and prisons and things like that. As far as the schools, Massachusetts has said that masks are required for staff and students of K through 12 and early education. And this will not change on May 29th. That distancing and other protocols, cleaning, ventilation, et cetera, are still required. That close contact is still defined as less than 6 feet for 15 minutes. And that you still will need to quarantine if you're a close contact, only if you are indoors and unvaccinated. So if you're a close contact, but it was outdoors, or you were a close contact and you were vaccinated, you would not need to quarantine. And that masks for youth and amateur sports no longer required outdoors. And that's would be for Massachusetts, and that's also MIAA has adopted that, although they do have some sports specific rules that they have. The no masks for youth and amateur sports does not cover spectators. So spectators would still be required to follow the, up until May 29th, outdoors it would be required if you can't keep 6 feet of distance. And then starting in May 29th, then you're just advised if you're not vaccinated. Masks are no longer required for students at recess or other outdoor activities, regardless of distance or what they're doing, singing, band, etc. And that the call today, they said that graduation and proms should follow the safety measures of the venue where they're hosted. So if you're doing it in the school, then it would apply for the school restrictions. And if you did it at a hotel or conference center, that it would follow the restrictions there. And so, as I said, that in the top corner, mask requirements are planned to be lifted on May 29th. The state of emergency is planned to end on June 15th. And they're still reviewing how to handle elections, remote participation calls, CARES Act spending, outdoor dining, those things that they haven't quite worked out the logistics of. So we'll find out more soon. So there's a few more detailed Massachusetts ones that basically travel restrictions on border crossings are strictly advisory. Vaccines, the Pfizer is approved for people 12 and older. They do worry about syncope, which is falling, and so there's a little bit longer evaluation time before you let the kids, go after having had the vaccination. There's been a rescinding of the timing of the vaccine. I think it was preferred that it didn't happen at the same time as other vaccines. And so that 14-day minimal interval has been removed. So now you can give it simultaneously with other vaccines. If you get COVID after having the vaccine, and it leads to hospitalization or death, then I think the Board of Health has to fill out a special, I think it was called a VARS form. And then in terms of taking aspirin or other blood clotting or blood thinner doses, if you're already taking it, Massachusetts says to keep taking it, but don't pre-dose before your vaccination. And they listed a couple of websites, the UCall, the shots, and I think the CDC also has a good pediatrician website that they recommended. And then as far as camps, most of the requirements that were called standards before, meaning that you had to have them, are being moved to advised best practices, which means that they are now, advisory and that they don't have to follow through with them. And so there's no cohort requirement. There was the 12 campers overnight or 25 during the day. These are now being they're still advising that you limit cohort size, but they're no longer required limits on size. Masks are still advised for unvaccinated indoors, and they do advise testing if you're indoors, unmasked, and unvaccinated. They do still require that you have 2 healthcare supervisors, which are people that are 18 years old and trained in the healthcare policy. So those are the Massachusetts requirements that, we'd be looking to kind of sync up with. And I think that they are, anyway, I kind of wanted to just run through this list of stuff so that anybody listening and so that you guys are aware of kind of where Massachusetts is falling right now.
Thank you. So I want to talk more about the kids, because I think, that was the question that was raised. And, one of the issues has to do with how the disease behaves in the pediatric population, where it seems like it doesn't spread as easily as amongst adults, and the disease is generally less severe, but not entirely. I mean, there are certainly severe cases that happen in all age groups. So, if there are specific suggestions for what we should be doing differently with kids, we could talk about it. It's unclear to me what is scientifically based advice for how to handle situations where there are children. I think we've had policies that have been based on what makes sense for limiting communicable disease in general, but how it applies to the specific risks of COVID to this population, it's unclear to me, what we would advise. I don't know, go ahead.
Yeah,
Go ahead.
I guess my question, unvaccinated children indoors. I guess that's my question is, do local businesses, do they look to the Board of Health for guidance on any of the? I'm curious. Would the local karate studios, dance studios, where these kids are all indoors, do they get any guidance from the Board of Health in this? I'm curious, and then the one place I guess that the town, other than schools, has a large amount of kids would be the library. I'm just, to me, unvaccinated children indoors, yes, we are hearing from the state they should be masked, but I'm just wondering if the town, should make that as a statement as well, because there just seems to be confusion among people and concern, I think, among people who have young children who are then going to go, into the town, into the state, into the country, and huge amounts of adults will be all unmasked, and all these under 12-year-olds are unvaccinated. And where I know the disease process is less severe and less frequent in children, I think they're, talking to parents, talking to physicians with young children, there is concern about that, and as a town, I'm curious about that. So, advisor.
Well, sometimes either individuals in town or businesses may reach out to us for advice or opinions. But in general, we either issue regulations and then we ask them to follow those regulations. We can issue advisories and make it optional, or we can be silent and let people do as they please, both individuals who might be unvaccinated at risk for whatever reason, or not. So
Yeah,
go ahead, Nathan.
I see that there's probably three groups of people out there in the sense of businesses or other people that are, hosting events and things. And one group would be the ones that are going to be more conservative than the Board of Health. They're going to have their own regulations, and they might say that, let's say masks are required. There's going to be another group that is looking to the Board of Health to be the bad guy that says that, you have to have these restrictions, but really they want the restrictions. And then there's the third group of places out there that really don't think that the restrictions are needed, and any imposition by the Board of Health, they would kind of resent and say that, it's, not needed. And so obviously the Board of Health has to try to figure out how to, navigate what's best for the citizens and not just pander to what people want, but really to try to make a good choice that we think is representative of the science. And I think that one of the other things that is going on is that as far as people over 12, there are vaccination sites, there are vaccine that's available. And so those people that are choosing not to get vaccinated, still have the choice to wear a mask, even if medically they, have, immunosuppressant or something like that that's preventing them from getting the vaccine. And also with the kids that are under 12, they do have the ability to wear a mask if they wanted to. If you were going to go to some setting where you knew that the policy was that there would be other unvaccinated people around, you could wear a mask. You could try to maintain, social distancing, whether it be at the library or something else, so that there are some avenues that people could take by themselves. And then the question is, what does the Board of Health want to do to try to, help people make good choices?
I just want to be clear. Even if you have some reason where you're immunosuppressed, that's not a contraindication to getting the vaccine. The vaccine may be less effective in people who are immunosuppressed, but they are still eligible. I just want to be precise on that. That's all.
Okay, thank you.
Most people. I can't imagine certain people on certain chemotherapies. Honestly, I'm not 100% sure, but I assume there are some people that cannot get it, but most people can, obviously, yeah.
The people, I mean, Ray, you can chime in because you've been at the clinics, but for Moderna and Pfizer specifically, the contraindications are basically if you have an allergic reaction to one of the ingredients, and the ingredients are, pretty specific chemicals. But, routinely people who are getting treated for cancer are being sent in, if they weren't getting it at places like Dana-Farber already, they were being sent into the clinics. Ray, you have any
Yeah, the only thing they're asking is if they've had something in the last 14 days or 10 or 14 days. If they had a treatment yesterday, they may, we have nurses on staff who say, well, what kind of treatment do you have? And, stuff like that. But other than that, no, there's been nothing, like you said, it's just just talking about the other stuff. It's really not, we've had no issues, just put it that way.
And there is the particular age group of 12 to 18 that if we had a policy that might encourage them to get vaccinated, I think that would be a good policy to have. And so if we had a requirement somehow, somewhere that we said that you had to be vaccinated, or sorry, you had to wear a mask if you weren't vaccinated, whether it be in something related to the schools or somewhere else where they might otherwise be free to go maskless, that might provide an additional incentive for people to get vaccinated. I haven't figured out how how that would work in terms of Board of Health regulations and what place, but I would like people to get vaccinated.
Right?
So one thing, Nathan, if you were on the calls like we were, it's the honor system. So people, if you walk in and, oh, I have been vaccinated. And the other thing, being HIPAA, you can't really ask anybody if they've been vaccinated or not. You can put the regulation out there that that we'd like you to be vaccinated in order to do this, but there's no way to ask anybody without going into the medical records, and that's HIPAA. So we have to be careful how we
Schools
handle
will
that.
have access to that though, right? I mean, they routinely gather vaccination data about the kids attending school, correct?
The schools can do that, but we can't do it outside of schools.
Okay.
Very
So it would
careful.
have to be something related to the schools then. Like, for instance, if Massachusetts says that masks are not required for outdoor sports for youth and athletics, I mean, we could, and I'm not saying we should, but we could have a policy that said, yeah, if it's a school-related sport, you still have to wear a mask unless you're vaccinated, if you're in the 12 to 18 range. Things like that would potentially sway some kids to get vaccinated if they were on the fence.
The other thing you have to look at is last year they required all students to get the flu vaccine. I don't know if it was 2019 or 2020 that students had to get before they returned to school. And then there were lawsuits and there was other things. So they if you notice, that's silently went away.
Yeah, Ray,
to be
precise, they mandated flu vaccine even if you were fully remote. And that was, particularly what got them into trouble, I think. But in any event, we've talked around about this. Is there a specific proposal that somebody wishes to make that we could discuss? We've talked about some of the general principles about the concerns.
So, I mean, let's say, let's consider for a second extracurricular activities in terms of things going on school property. If we wanted to say that at the 12 to 18 range, I don't know what that would be, high school and the middle school. If we said that you needed to be vaccinated in order to participate in those activities without a mask.
Okay, so that's certainly something we could
And then I
consider.
think, Melissa, you were thinking about maybe something along the lines of something with a library, I think.
Yeah, especially with indoor, obviously a lot of the activities, the after school activities right now are outdoors. And the school system has already come out with a statement saying that all outdoor sports after school, affiliated school sports can be unmasked outside. I don't know how that goes, for the after school activities that are affiliated with the town, not the school. There's a lot of those too. So, but the ones with the school, so I don't even know, if we, did the school come to ask the Board of Health, advice on that, or did they just went by the state and made that decision, correct? I assume.
The school can have more restrictive policies than the state, and as far as I know, the schools have not changed any of their policies except for maybe the no masks at recess.
No, they came out, I think today or yesterday with no masks required for any of school sports.
So in general, the school department's been collaborating with us. In this particular case, they did not.
They did send out to me, they sent me the list of what they were sending out and it met the state guidelines. And if it meets the state guidelines, I said, that's what we've been working with. So that's all they sent to me to ask me, and it met the state guidelines.
And in fairness, I think over the past, say, 4 to 6 months, the board has been trying to encourage the school department to be more open, to do more things that the people who would label themselves as cautious have been reluctant to do. And so, what Ray is telling them is certainly consistent with the advice they've gotten from Nathan and myself over the last couple of months.
Can we think of any other ways that, besides what I proposed, that we might be able to encourage those 12 to 18-year-olds to get vaccinated?
I guess I have less concern about the need to encourage them when you look at the rates of vaccination in this town, okay, obviously the parents are highly motivated to get vaccinated. And, while it is true, I've had many teenagers in my household over the years, and it's true that they can be somewhat feisty and resistant to parental authority. Uh, uh, for the most part, if the parents want the kid to get vaccinated, the kid's going to get vaccinated, and that's usually not something there's a lot of negotiation around. So I expect high rates of vaccinations amongst the 12 to 18 population, no matter what we say. Maybe I'm wrong, but that's my expectation.
Ray, on the cases that we've been getting in town, I have one of the things I did not check was kind of the age brackets that we seem to be getting recently. Is that what you're pulling up right now?
Yeah, this is the last couple weeks. I had 2, 3 under the age of 19. I had 6.
Over what time period?
This is since let me get the date here. Since 4/28 till 5/13. I had
So over about 2 weeks. Yeah, six cases.
6 kids under 1, 2.
Yeah, so that's actually a fairly small percentage. So
Yeah.
yeah, maybe it's unfounded to put in place, some of these more stringent restrictions at this point in time.
If you look at the weekly report I send to Dr. Ehrlich every week, the numbers on anybody under 50 have gone up like 1 or 2 a week. Anything over 65, I haven't had any for 5 weeks. I think I have one person who's 68, but other than that, for the last 5 weeks, I have nobody over 65. That's because we're 95% vaccinated over 65. So, and from what I was getting emails or texts from the clinic, the clinics is booked solid from 2:30 to 5:30 every day this week, and that's when we're doing 12 to 15-year-olds.
Okay.
It may not be all Westborough, but we're filling the clinics 2:30 to 5:30 at the DoubleTree.
It's booked through the end of the month, I think.
Okay, so I'd like to rescind that motion that I had put out there.
Kim?
I'm happy with the progress right now. We'll have to see how camps and stuff like that go over the summer, but.
Melissa, do you have anything in particular you want to try and propose or suggest?
I mean, I guess I would propose that we make an advisory to our town private, businesses that have indoor sporting for children to stay masked. I don't, like I said, I wasn't sure if that's something we can do. But I do think in the 12 and under indoors, even I'm trying to think of those places where the kids, jump around.
Trampolines or laser tag. I mean,
yeah, I mean, to me, it just seems like, for 12 and under indoors where, kids are all jumping around together or doing karate or dancing or whatnot. But that would be my recommendation.
my question, go ahead, Nathan. Go
I
ahead.
was gonna say, if we tweaked it to saying something like the Board of Health supports businesses tailored to kids that cannot be vaccinated, that that we advise them to, have the kids wear masks. That something along the lines of that we're supportive of those businesses that choose to have the kids wear masks. I think that's something that I would be in favor of. I don't know about you two.
I guess my question is, I don't know when we're going to have a vaccine for under 12-year-olds. Okay. So the question is,
supposed to be September. It's supposed to be September. It's supposed to be September from what I'm hearing, yes.
Okay. So the question is really, how long, would we be recommending this? And is there anything we can point to support this in terms of even cohort data or things that, if someone says, well, why are you still recommending this? Nobody else is. What is our rationale?
Well, I think that most places are recommending that unvaccinated people wear masks. I mean, that's consistent with the CDC. I think that's consistent with Massachusetts. They're not requiring it, but advising it. And so I think that it would be consistent with the Board of Health here to then reiterate that we are also advising unvaccinated people to wear masks.
Okay.
Right. I mean, if somebody is advising that you don't need masks, I think that's what the CDC is saying for vaccinated people. I don't think that we're saying that about the kids that 10 and under at this point in time. But in terms of a sunset or when we think this should apply for how long, I mean, as long as we're getting kids that are, in that age bracket that are getting COVID-19 each week, I think that we should continue to advise them to wear masks.
Let me push you on that. Why?
Sure.
In other words, so we have 6 kids who've gotten COVID in the last 2 weeks. Nobody gets hospitalized. We don't necessarily, are we going to pass the same regulations when it's flu season? We haven't previously. I think it's hard for me to reconcile what was being suggested with the risk in children of what happens when you get the disease, which is very different than what happened when people over 65 were getting the disease and they were getting hospitalized and dying in very large percentages.
We would,
Well,
go ahead, Melissa.
I mean, if you look at other countries right now, and the variants, in Brazil, for example, kids are getting very sick. So, I mean, I think you don't have a lot of cases in children because, you have mandated masking, schools are all masking, preschools are all masking. Everyone's masking because it's a Massachusetts requirement. I guess my concern is with all these adults basically unmasking. You have the honor principle, and I think a lot of adults are going to go around unmasked even though they might not be vaccinated. And then people are like, well, what about children? And so I guess that's I think the cases are extremely. I'm very hopeful, as you are, that we will not have a bounce in cases when all these changes kick in. But kids have been masked at recess. Kids have been masked outdoors for everything, and kids have been so they're obviously we don't know yet if
Sure.
things will change.
I would say
I hear you.
certainly, at least in my neighborhood, when the kids are playing, the masks are not being worn. But again, they're outdoors in those situations. I'll grant you that. So, do we have specific language here so we can bring this to a conclusion? If it's, I'm hearing an advisory that supports businesses that continue to recommend masking for those who are unvaccinated indoors, which is certainly consistent with what the state has said. The state says any business can do whatever they want in that regard. And it's not, if a business wants to exclude people who are unmasked, they're able to do so. And if we want to issue something that supports that state guidance, I'm fine with that.
Yep, I think that's exactly the wording or not the wording, but that's the sentiment that I'm looking for as well. The Board of Health supports businesses that are encouraging the unvaccinated to wear masks.
Including children under 12 or including, something like that.
That sounds great. Thank you.
So if I make that motion, do I have a second?
A second.
Okay. We'll do roll call vote. Dr. Walsh,
Walsh, yes.
Dr. Mayer,
Mayor, yes.
and Dr. Ehrlich, yes. Okay. We're almost done. Vote to appoint member and alternate to governing body of shared services grant. Ray?
There we go. So with the shared services grant, they're going to have a governing body, and they're also, over the next 2 months, they're going to have somebody meeting to figure out what we're going to need for nursing. So I'm just looking, we're going to need a letter at some point, which I'll bring to the next meeting. They're going to draft one so I can have you sign it. I don't know if we need to vote tonight, but if we're going to vote, I would rather be vote by position and not by name. Maybe you have the director on the board with the sanitarian, or even Paula being the being the second person. But I don't want my name, because if I get locked in for a year with everything else going on, I'm just a little overwhelmed right now. So if we could get a vote that says the member for the governing body would be the director of public health for the town of Westborough, and the alternate would be the sanitarian, I'd be fine with that. Or you guys can choose who you want. They said the governing body member could be the Board of Health, or it could be someone from the board member themselves. So it'd be what you wanted to do. It's a voting member. They're going to be meeting, I think, quarterly. I think monthly to start for the first 3 months, and then it's going to move to quarterly. So unless somebody from the board would like to step up and do that, or it can be someone from the office. That's all we're looking for.
And what are the duties of the board vis-a-vis this grant?
So from what it was, if they just rolled it out the other day, and I just wanted to bring it here so that way you would know about it. What's going to happen is the governing body is going to be more or less running the grant and making sure that the money's being used appropriately. And if there's any missing or something that's not working for one town, they can speak up at this meeting and discuss why things aren't going the way they need to be going. So it's just more or less a group of 4 to 5 people who will be voting on changes to the grant. If they think somebody, one town isn't doing what needs to be done, then they can move.
Yep. So given given what you've described, I think it's more appropriate for it to be department people rather than the board people, because you'll have a better sense of how programs are being funded and enacted and what the needs of things are. So
That's fine.
So I would make a motion that we appoint the Director of Public Health or the Interim Director of Public Health as the member to this governing body of the Shared Services Grant, and that we appoint the sanitarian to be the alternate.
Yeah, I don't have any issues with that. I also agree that having it be one of the people in the department makes more sense than the board. I think that as we start to decide kind of roles and scope and stuff like that, maybe it made more sense to have a board member as part of that decision making. But now that we've kind of have the shared services grant kind of a little bit more structured already, and it's more into implementation, I think it makes more sense to have a department member.
And Nathan, for what it's worth, on the meeting to help get this thing going, I had participated along with Christy and whatnot. So there was input from the board.
Yeah, that's what I was trying to reference, is that the transitioning from you to the department makes sense.
Absolutely.
So I second that motion then.
Okay. Any further discussion or any questions? Okay. Dr. Walsh?
Walsh, yes.
Dr. Mayer?
Mayor, yes.
Dr. Ehrlich? Ehrlich, yes. All right. We need a June meeting date.
And if I can interject, Kim wanted me to, she sent me a text a little while ago, wanted to know if you could set an off meeting date that you think would work for a director to interview directors.
Yep. Okay. Let's just do the June date first and we'll go from there.
So I'd prefer the 22nd of June rather than the 15th, but I could probably make it work if we had to do the 15th.
I'm okay with pushing to the 22nd.
This is going to be an in-person meeting?
That would be our plan, because the state of emergency will be over.
Yep.
And so presumably the governor's suspension of open meeting law will no longer be in effect.
I think though that they were saying that the feedback that they've been getting is that it's actually helped more people become more involved in what's going on in these town meetings by having them, tailored with like Westborough TV and all these other things that have made them much more public than when they were held in person. So I believe the state is looking into crafting some legislation to keep this going even after the emergency ends. But you're right that as of right now, it looks like the emergency will end and these will then no longer be possible the way they are now.
Yeah, I think the state gives 60 days after the state of emergency or 30 days that you have to go back to in person. So
Okay.
you have the summer anyways.
But I would like to do in person.
All right. So is the 22nd okay? And Paula, do you think you can get us a room?
Oh, I absolutely can.
Excellent.
I have connections.
Excellent. Okay. So then regarding the dates that had been put forward from Kim, I know I have not had a chance to review that. So let me pull up my emails right now. Seven.
So, Dr. Ehrlich, Kim said that both you and Dr. Walsh and Dr. Ehrlich both said they could do 5/27 next Thursday, but she did not hear from Dr. Mayer yet if that was a possibility. But that's what she just sent me in the email.
Okay.
Next Thursday, you're saying the 20th or the 27th?
27th.
The 27th.
So what is this that we're talking about?
I'm sorry. What's the question?
I'm asking what is on the 27th. I'm sorry.
Yeah,
I
we need to interview candidates who would take the place of Steve Bakari, who was our former director. Ray is the acting director or interim director. And so we have two candidates that we will interview that day, and we will then, the appointment is the authority of the board. So the three of us have to make a decision, and we had already had two candidates ready, but we were waiting to fill out, so there'd be three people on the Board of Health to make that decision.
So I'm sorry, the 27th, what time?
5:30 or 6.
5:30 is better than 5 for me, but I don't
I'm
know.
fine with 5:30. Is that an okay day for you, Melissa?
Fine, yes. Yes.
Okay. So that's going to be 5:30. Do we want to do that remote as we're doing? Or we could, in theory, do it in person?
I will be remote, but
And let's just do it remote.
and then you can call me in.
Yeah, Kim said it was the choice of the board.
It was what?
Kim said it would be the choice of the board. She had asked if you wanted to do it in person or remote, but it'd be your decision.
Let me just ask Nathan and Melissa, if we did it on the Tuesday, the 1st or whatever the day is, that's not going to be possible to do in person because I'm going to be down on the Cape. Okay, never mind. All right. So I think we just do it remote, and that's how it is.
All right.
Yeah, I think my calendar fills up quickly, and so as we get closer and closer, if I haven't reserved a spot, then it gets busy.
All right. So Ray, you want to communicate that 5:30 on the 27th will be when we interview the candidates.
I'm sending her an email right now.
Okay, and I believe all of that is let's put it this way, none of that is an executive session. It's all open discussion. Is that correct?
It's all open session.
Open session.
Yeah.
Okay. For what it's worth, I will work with Kim. We will have some standard questions prepared. If there are individual questions and she will send them out. If there are additional questions you would like added, we will do that. But the general notion is we will ask a set of fixed questions of both candidates. Then dialogue can follow however the questions go, but each candidate will be asked the questions, the same questions. In addition, each candidate was asked to prepare a transition plan of what they would hope to accomplish in their first 90 days, and that will be presented for your review.
Good.
Any questions? All right, so Ray, I think what I would like if we could work with Kim to get out the proposed questions by Monday at the latest, so that if any feedback from the board members for additional questions, we can add them. And some of the questions may be the same as what we used in the first rounds of interviewing. Obviously, the board hasn't heard the answers, and they can be varied a little bit. And some of the questions are in that round were much more geared to the other people on the committee, the other department heads. So I think we would want a little more in depth of things more specific to the board's relationship to the director.
Okay. Well, Kim is listening to the meeting, so she's texting me that it all sounds good.
Excellent. Okay. I will. So then I think we're ready to adjourn.
I make a motion that we adjourn.
I'll second. Any discussion? Dr. Walsh,
Walsh, yes.
Dr. Mayer,
There, yes.
and Dr. Ehrlich, yes. Okay. Thanks, everybody.
Well, thank you.
Thank you.